welcome and thank you for coming to the webinar series from the Eye and Ear Foundation called Sight and Sound Bites. This bi-weekly webinar series highlights research at the University of Pittsburgh School of Medicine. Today's topic is Integrative Ophthalmology, a holistic approach to eye care. I'm Lawton Snyder, CEO of the Eye and Ear Foundation. The Eye and Ear Foundation supports research to advance care for vision, hearing, balance, voice, and cancers of the head and neck at the two world-renowned departments of ophthalmology and otolaryngology at the University of Pittsburgh. The funds we provide from the Eye and Ear Foundation to support research are only made possible because of philanthropic support. We want to thank all of you who have supported us over the years and welcome anybody else who would like to find ways to support the research that you're going to hear about today. Our housekeeping rules for our webinar series. We disable chat. So if you're used to chatting with your friends, you won't be able to do that here. We do have a Q&A function that is enabled. So you'll be able to click on the Q&A at any time during the presentation and ask your questions. Please ask questions. We really encourage it. Towards the end of the program, after the speakers have both finished, I'll read the questions to the speakers. And again, you're welcome to ask those questions anytime as they come up. We will ask that you refrain from questions that are really specific to you and your personal health issues. At least what I can tell you is we probably won't be reading those to the audience because we'll try to keep it on topic with what everybody would want to hear. But if you have personal questions, please send them to us. And you can send them to Craig Smith, who sent you the invitation. And we'll make sure that those questions get answered. Please feel free to use the subtitles function below if you need to. And we'll be adding, we want you to know that you'll be on our list once you're on, unless you choose to get yourself off, you'll be getting invitations through our webinar series. So today's speakers, and these are, I'm very proud to introduce the two speakers that we have today. Dr. Deepinder Dhaliwal is a professor of ophthalmology and the director of the Cornea, Cataract, and External Disease Service. She's also the director of Refractive Surgery Service and the medical director of the UPMC Laser Vision and Aesthetic Center. She's the director and founder of the Center for Integrative Eye Care. She's also the associate medical director of the Charles T. Campbell Ocular Microbiology Laboratory and the director of the Cornea, External Disease and Refractive Surgery Fellowship, and the clinical co-director of the Thunderberg Cornea Regeneration Project, all here at the University of Pittsburgh School of Medicine. Dr. Dhaliwal, thank you, and thank you for doing all that you do. I'm also going to introduce Dr. Hélène Errera. Dr. Errera is an associate professor of ophthalmology here at the University of Pittsburgh School of Medicine. And Dr. Errera's clinical work specializes in uveitis as well as work in the retina. So you're going to get to hear from these two wonderful, talented people today. And I'm going to go ahead and turn it over to Dr. Dhaliwal.
Thank you, Lonnie, and welcome to everyone in our virtual audience here. We really appreciate you logging on. I am so excited to be here with all of you, but really excited to co-present this webinar with my dear friend, Hélène Errera. I've learned so much from her, and it's really exciting that we both share this passion for holistic eye care and this kind of integrative approach as we see you, our patients, and think about how to better serve our patients. So our topic for today is Integrative Ophthalmology, a holistic approach to eye care. Let's get started. I have no financial disclosures in the material we're going to discuss today. So the Center for Integrative Eye Care is part of the UPMC Eye Center. And we established the center in 2007 in our department, and it is the first in the country. Our goal is to approach each patient with eye disease in a holistic manner. We have studied acupuncture And we plan to incorporate nutrition, behavior modification, mindfulness, and psychology. We're very excited to move into our new Vision Institute next year, so we have space for all these programs. Just a little background. Why acupuncture? You might think, well, I went to MD medical school and acupuncture was not taught at all in my medical school, but I was actually having an acupuncture treatment at Lake Austin Spa in 2005. And as I was laying there with needles in me, I thought, wow, this is an incredible practice of medicine that's been around for thousands of years. And why don't we study it for the eye? What are the applications of this for the eye? So I became very interested and I started my study of acupuncture in 2005 through UCLA. And I became a licensed acupuncturist in 2006 and then established the Center for Integrative Eye Care in 2007. And so the idea is to blend East and West to optimize patient care. And it's especially important when the limits of Western medicine have been reached. And we really want to perform validated studies to objectively assess efficacy. So we want to really scientifically study these integrative techniques so that we can validate them or invalidate them and really understand what works and what doesn't. So I'm going to start with acupuncture because that's what I studied. And what is acupuncture? And I know a lot of you are thinking it's hocus pocus, but I would like you to know that their roots are in China 2000 years ago. And the concept is that all living beings have a circulating life force or qi that protects, nourishes, and animates. And this concept in the Indian tradition is known as prana or pneuma in the Greek tradition. And the qi, or this energy life force, circulates through a network of channels, invisible acupuncture channels or meridians that cover the body. And there's lots of points and meridians that we had to study that are throughout the body. And the concept is that disease or dis-ease occurs when there's a disruption in the flow of qi, so that the stimulation of specific acupuncture points can remedy the disorderly flow, remove the blockage, and restore the natural energy, thus treating disease. So the flow of qi is like a flowing stream analogy. If you have a blockage of the stream, you get stagnant water to build up and you have a deficiency of this water downstream. So that's what acupuncture is. You want to keep people healthy, to keep them in ease and not have dis-ease. So acupuncture has been accepted by the NIH, and they actually formed this National Center for Complementary and Integrative Health, which is one of the 27 institutes and centers that make up the NIH. And the mission statement of the NCCIH is to determine through rigorous scientific investigation the fundamental science, usefulness, and safety of complementary and integrative health approaches and their roles in improving health and healthcare. So the budget was close to $160 million for FY 2022. And again, does it really work? Well, studies have shown that acupuncture can alter immune function, alter the secretion of neurotransmitters and neurohormones, and alter the regulation of blood flow. So how about for dry eye? This is the first study that we conducted, and we completed an IRB-approved, randomized, double-blind, placebo-controlled prospective trial at the University of Pittsburgh. We had 49 patients, and the protocol was developed by the gentleman in the center. His name is Dr. Richard Niemtsau, who is an acupuncturist and an MD. And these are where the needles go. No needles in the face or the eyes. The needles go in the ears and the fingers. And these needles are not like the typical needles we use to draw blood. They're very thin, very flexible, and they don't have a lumen. So they slide between cells instead of impaling them. And each of these treatments lasted 45 minutes, and we did 2 treatments one day apart. And the effects typically lasted about 9 to 12 months. So in our study, we had 2 groups of patients, because all good studies should have randomization into a real acupuncture treatment group and then a sham treatment group. And that's where needles are placed in the arm where there's no known acupuncture points. And then we evaluated our patients at several time points and looked at signs and symptoms of dry eye. And we published our findings in the journal Clinical Ophthalmology. And what we found is that The true acupuncture treatment significantly improved patients' subjective assessment of dry eye symptoms as compared to the sham. So patients felt better. And they required less artificial tear drop usage even 6 months after treatment, and had significant improvement in tiredness and redness at 6 months. However, there were no objective differences. So when we looked at how much tear production there was, or the breakup time, or the staining, we really didn't find a difference in the objective measures. So possible mechanisms of effect: reduction of inflammation, modulation of autonomic nervous system or the immune system, or reduction in pain intensity, or possibly increase in the pain threshold. Now, what are some other kind of validated alternative or complementary integrative techniques that we can think about for eye disease? And these are things that we have not studied yet, but we are thinking of incorporating or studying. And one is meditation. So meditation for glaucoma. This was a big article that came out in the Journal of Glaucoma. And this was a group from India. And they actually looked at the biomarkers as well. So they found that mindfulness meditation reduced intraocular pressure. So lowered intraocular pressure and lowered stress biomarkers and modulated gene expression in glaucoma patients. So this was big. I mean, this was very interesting. And the conclusion was that a short course of mindfulness-based stress reduction by meditation reduces the pressure and improved quality of life. So this is fascinating and really something that we want to replicate and see what is behind there. And again, I think that these studies need to be done. More studies like this need to be done to understand. There was also an editorial that spoke about this: mindfulness meditation can benefit glaucoma patients. And the bottom line was that there was, kind of a decrease in stress. And that was one main mechanism of improving the pressure. So in summary, I think integrative ophthalmology is a holistic way of treating patients with eye disease. I think that we really need to look outside, think outside the box, think about other ways that we can heal and help patients really heal themselves. I really think that this is a fundamental concept that we're thinking about, is that, patients, that we all can potentially heal ourselves if we can get the right tools. And some of those tools are just different way of breathing, different way of thinking, different way of, kind of addressing certain diseases. And, maybe these techniques such as acupuncture, meditation, mindfulness, nutrition, as we're going to hear about soon, can really benefit the Western approaches that we have to eye disease as well. So I think that the East and the West really need to blend together to form a very strong partnership in helping all of us, really reach our full potential in terms of being well. So the Center for Integrative Eye Care was developed again in the Department of Ophthalmology, UPMC Eye Center, in 2007. So we want to continue to validate these complementary approaches with well-designed scientific studies. And it's important to do this because we see so many of these treatments where, there's an ad for this or kind of a webinar about this, but if they don't have science or validation, then we just don't know, does it work or does it not? And sometimes, we'll spend a lot of resources on treatments that may not have scientific merit. So I think that it's important to really scientifically study these treatment approaches. So acupuncture, nutrition, meditation, behavior modification are some modalities that will be studied. So thank you for your attention. this concludes my portion of this presentation. And I really want to say a big shout out to the Eye and Ear Foundation family, which includes all of you. Without the Eye and Ear Foundation supporting the departments of ophthalmology and otolaryngology, we really would not be able to continue this kind of groundbreaking research that we're doing and really exploring these different avenues of treatment. And we're super excited to be in our new building, the new Vision Institute, which I'm sure most of you have seen as you're driving along the Boulevard of the Allies, which is just right next to Mercy Hospital. This is going to be amazing for clinical work, research collaboration, and to really further our efforts in the Center for Integrative Eye Care, because we'll have the space we need and hopefully the resources we need to continue these studies. Okay, so now I'm going to pass the baton to my dear friend and colleague, Hélène Errera, who is just fabulous. She's very thoughtful, insightful, and is going to speak to you about her interests. Thank you.
So hello, everyone. Thank you, Loni, for the nice introduction. And thank you, Dr. Dhaliwal. I'm so lucky to have you as a friend and colleague, and you're always so positive, full of energy, and so knowledgeable. So your talk was fantastic. So I'm going to talk also about integrative eye care, which now you've heard about it. It's a complementary approach to both eye care and health maintenance. Is a holistic approach to eye care, integrating health and wellness. So I'm a uveitis and retina specialist, so I am interested especially in inflammatory eye condition. And when evaluating a chronic inflammatory eye condition, we look at the entire health and lifestyle, which means that we look at all areas of life and to look at if those areas of life are connected. We soon will be starting a clinical trial to understand the links of lifestyle habits on inflammatory eye disease. So I'm very excited about, and hopefully the result of this study will allow us to get a more holistic approach to the treatment of inflammatory eye disease. So who are we? That's the plan of my talk. Our team and collaborators, the eye conditions that the trial will be interested about, and what is about this trial. So that's me in the OR. So what are the different inflammatory eye conditions, just for you to understand a little bit better what means uveitis, which means inflammation of the eye, and it's caused by an heterogeneous collection of disorders. It can be autoimmune, and on the right side you see examples of autoimmune disease. It can be sarcoidosis. We don't really know if it's autoimmune, but it's part of the autoimmune disease so far. Rheumatoid arthritis, celiac disease, multiple sclerosis, lupus, and many others. And uveitis can affect the eye if it's an infection as well, virus, parasitic or bacterial. We're talking a lot about COVID recently, and COVID can create uveitis as well. So I'm working at Children's Hospital where I'm now, but also other locations, Eye and Ear at Oakland, Mercy, Shadyside. And on the right, the new, again, talking about the new Vision Institute we are all so excited about, and this picture was taken last week. So what is uveitis? So there is sometimes a poor prognosis associated with uveitis if we don't start the treatment on time, and if we don't diagnose it on time. Because there can be complications like inflammation of the macula, macular edema, cataract. We can do a surgery, glaucoma. We just talked about glaucoma with Dr. Dhaliwal. Posterior synechia, that means attachment of the iris, like you see on the top right of the picture. Retinal necrosis, meaning a loss of retina simply by a virus most of the time, ischemia, no blood supply, and optic atrophy. So there are 20 major subgroups of uveitis depending on the cause. And uveitis can be very painful, and like on this patient with a red eye, so we need to rush to start a treatment. So our team, it's a network of ophthalmologists at UPMC Eye Center, but we work closely with rheumatologists. I just put the picture of two of the rheumatologists, Dr. Koka, Dr. Kietz. And we work with infectious disease, with clinical immunologists, with pulmonologists, and they're trying to detect the cause of uveitis. They involve a lot of imaging, like stress X-ray, MRI, because they are connected to other autoimmune disease most of the time. So I'm excited about this clinical trial that will start very soon because of a recent IRB approval. And we're working with the Center of Medicine and Microbiome from Pittsburgh University because the main outcome of the trial will be to determine the gut microbiota species associated with the different subgroup of uveitis. It will require a stool sample with a microbiome at home kit to get the result. But it's not only about microbiome, it's a connection of microbiome uveitis with diet, smoking, obesity or not, physical activity, anxiety, sleep, depression, pain. That's why it's a very holistic approach of treating this inflammatory disease. And we will ask the patient if they suffer from uveitis or iritis, that's the same thing. Does the stress influence the level of inflammation or the numbers of flare relapses? Do they sleep well? Do they exercise enough? What is their diet? And do you take alcohol, etc., etc.? And we have the help from Professor Ganguly, Professor of Psychiatry, to help us with all the questionnaires involved in that trial, and patient will receive questionnaire at each visit to complete, just to know a little bit more about this sleep, depression, pain, BMI, physical activity, etc. Those are examples of questionnaires that will be given to patients. This one is about the diet. This one is about anxiety. In that trial, there will be also a blood test to determine the presence of cytokine, chemokines, and hormones. So those cytokines are biomarkers just to try to determine the level of inflammation in the body. And the hormones changes, do they have any correlation with the level of uveitis and the level in the uveitis as well, like cortisol, estradiol, progesterone. To be eligible for the clinical trial, the patient will have to follow the criteria to be met. They will need to have uveitis, but any subgroups will be included. Any form of uveitis will be interested to study. The participant will be willing to provide fecal and blood sample at each visit. And they will also fill a list of medications, anxiety, sleep depression, chronic pain, and dietary questionnaire at each clinic visit or by phone. And there will be a list of exclusion criteria. So this study will be conducted for a time period of 3 years approximately, and 2 years for the recruitment and 1 year for follow-up. We're going to start with 100 patients. That will mean 700 samples. And all the collaborators are listed in that slide. From the Microbiome Center, from the Psychiatry Department, biostatisticians, immunologists. You have at the bottom of the slide the email and from me to contact if you're interested to enter the trial, and from the clinical trial coordinator, Mrs. Dahlström. So in conclusion, together we'll work to find out how better managing your eye conditions. Those BMI has an impact on the disease, food, diet, mental and physical energy, because so far we don't know. And the goal is to get a deep understanding of the food and lifestyle choices that works best for you and that will improve inflammatory ocular disease. So thank you to the Eye and Ear Foundation and to the private donors.
Well, thank you, both Dr. Dhaliwal and Dr. Errera. Certainly very enlightening. And it's funny, there is still stigma sometimes attached, and Dr. Dhaliwal mentioned it with the hocus pocus comment, but it should make sense to us by now that managing stress and managing the things in our life that help us in other ways with our cardiovascular health and overall physical health would also have a role in helping us with our eye health. So it does make logical sense. But congratulations to both of you for taking the time to look at the specifics of what you're doing, to apply science to it, and to try to measure how that impact is felt. I'll start with a question. We have some from the audience already, and this is the time to ask questions, folks. So please go ahead and put your questions in to the Q&A below, and I'll start to read those here in a second. Dr. Dhaliwal, you mentioned this connection to glaucoma, and I have to sort of ask, how significant of an impact some of the holistic approaches can have, because of course we know glaucoma has to be controlled to be able to spare vision. And I'm sure kind of works in conjunction with other therapies, but is it possible for people to use holistic approaches exclusively once they've been diagnosed with glaucoma, or is that just not likely?
Okay, that's a great question, Lonnie. And I think what's important is that we should blend East and West, right? I think that this is integrative medicine. This is a holistic approach. This is not just forgetting everything that your glaucoma specialist told you and just all of a sudden, taking to another, starting on another path or avenue. It's very important to be monitored closely. And what I tell my patients is that, we're open-minded. If there's a therapy that you start that is helping you and we can monitor that improvement that's consistent across the board, then that's one thing. But if it just helps a little bit and then the effect wears off and your optic nerve is getting more damaged, then we need to kind of change gears there. So it's important to really understand that, you have to be mindful about the approaches you take and not just think that it's, one treatment's going to be kind of the magic bullet. It often takes a variety of things working in concert to really have the most benefit. So I would definitely say that any of these treatments, and even Eastern medicine, Western medicine, all these things, they don't all work for everybody. So we have to find what works for you. And again, you have to be monitored closely in any case.
Thank you so much. So first question is, do you coordinate with the Center of Integrative Medicine at Shadyside?
Another great question. And that's on my to-do list. So what we do now is, honestly, we really would love to have an acupuncturist as part of our department or coming into the department to handle our patients. But I do coordinate with them. I want to go meet the newer acupuncturist. I know some of the acupuncturists who have been there for a while, but not the newer one. So I've been meaning to kind of go over and introduce myself and to understand. So I know a few of the practitioners quite well, and everybody has their own approach. So I will tell you this: acupuncture is an art, and it's not like just one protocol works for everybody. I am, very early in my acupuncture career. So, kind of, I'm at the grade school level, right? I don't have a PhD in acupuncture. I'm nowhere close. The people who do it every day, all day, they really know. There's so many nuances. I learned when I studied acupuncture, there's actually 6 different pulses in each wrist. And, you have to look at somebody's tongue to really understand what's going on. There's so much to learn. It's really an art. So that when you see an acupuncturist, you really have to trust what they see and what they diagnose. I can't tell them how to treat, oh yeah, use this protocol. I mean, that's what I learned, but that's not necessarily what they would do. So when we integrate with them, I just say, I have a dry eye patient and I encourage them to go to the Shadyside Center for Integrative Medicine for help, but I don't prescribe a specific treatment. So the answer is yes, I do coordinate with them, and I need to introduce myself to the newer practitioners as well.
So I anticipated this question because I know this is a question a lot of people have. Are you doing work with age-related macular degeneration?
So I'll answer that from an acupuncture standpoint, and then I'd love Marie-Hélène to talk about the nutritional aspects of macular degeneration as well. So yes, we have done a pilot study in acupuncture for macular degeneration. And again, before I speak more broadly about it, I definitely want there to be a peer review publication that we have. So we're scientifically reviewing and really going through our data before we can make any definitive conclusions. But yes, we have studied that. And I will tell you that, some of the results are incredible, but they're not lasting. So, and some of the dry macular degenerations develop wet macular degeneration. So it's not for everybody. It's not, the magic bullet again. And we need to understand it more. So that's why I didn't put it in my presentation, because I think that when we present to a large audience, we have to be scientific, we have to have validation, and we have to be mindful of what we're talking about. So yes, that's in the works. And we'll get back to you on that. But nutrition has been extensively studied in macular degeneration. So I would love Marie-Hélène to talk about the kind of the vitamins, the nutrition, et cetera. So please, Dr. Errera, if you could enlighten us.
Hi, thank you. We know for age macular degeneration, there have been studies for retinal disease about nutrition, about these vitamins good for the eye, and all these antioxidants. So like vitamin C, lutein, zeaxanthin, so that patients with age macular degeneration that are used to take a vitamin supplement called RH2 vitamin. But it's only for age macular degeneration, to my knowledge, that we know what to eat and which supplement to take. And every day in my clinic, patients ask me, I've got an inflammatory eye disease. What do I need to eat, to drink? Shall I stop drinking alcohol? Shall I stop? So we know that uveitis are autoimmune disease. We know that what is good for autoimmune disease, so green vegetable, fruits, like the antioxidant things as well, but we don't know what's not good and what to recommend to our patients. So that's why such studies are interesting.
But I think across the board, we know that smoking is bad. Smoking is bad for everything. Smoking is really bad.
It's bad for autoimmune disease, but I've listened recently a talk about a pulmonologist about sarcoidosis, and smoking is good for the pulmonary, for the lungs. I mean that patients who smoke, they are less affected by sarcoidosis in the lungs. In my experience, but we need to do study when they have sarcoidosis in the eye. If they smoke, that's getting worse. So, so the pulmonologist was not recommending for patients to start smoking, but was recommending to do some study to try to understand if something can be done also.
So yeah, but in general, I mean, I think
in general that's bad, very bad.
Smoking is really bad. For dry eye, for macular degeneration, for inflammatory conditions, obviously for your lungs. So, you know, some people say, oh, I smoke and, you know, I just can't quit. And I say, well, you know, if you have macular degeneration, then smoking is a risk factor for progression of that. And if you value eyesight, then definitely quit smoking. If not for your lungs, do it for your eyes. I think that's really, really important.
And for inflammatory disease of the eye as well, it's very difficult to stop the inflammation, even with immunosuppressive treatment when patients smoke. So yes, I agree with you.
And
So,
the other, the other simple thing in terms of, well, we're talking about just, you know, macular degeneration is UV exposure. So the sunlight can also be harmful to the retina. So definitely simple things like wearing sunglasses and a hat when you're outside, really good sunglasses that wrap around so that you're limiting how much UV gets in your eyes. I think that's really important. So these are simple things. Eating, you know, a diet full of antioxidants that Dr. Errera just talked about, really important. Kind of those green leafy vegetables have been shown to be of benefit. So
we think there are hormonal, those diseases for the inflammation of the eyes are autoimmune. We think there is a role of the hormones as well, because it's more often women at a certain age in their 20s and then in their 50s. So we think there are hormonal changes related to the occurrence of autoimmune disease, but we don't really know what's going on. If there is any environment factor associated to those hormones as well. And I've got patients in the clinic every day, they say, I've started a diet, high protein diet or low protein diet, and then my inflammation flare. What do I need to do? And no one knows actually. So that's why the study are important as well.
Well, so what I obviously we do know that there's no current treatment for dry form of macular degeneration, but the common recommendation is all the things we're talking about here: exercise, nutrition, stopping smoking, and we also hear about the supplements. So one question here is there any proof that the over-the-counter supplements are actually effective as it relates to dry macular degeneration?
We know that it can prevent the occurrence of a wet form of age macular degeneration if the patient is affected by already a wet form in the other eye. And a dry age macular degeneration can convert in wet form anytime. And then it can make things even worse. So there is definitely an indication, yes.
Wonderful. And again, I think, you know, logic comes into this, right? Because we know that we're seeing the tie to the immunotherapies working in some respects to these, or potentially working for some of these things related to macular degeneration. That I know there's a lot of research that we're also supporting in these areas to try to find those treatments in the future. So we have immunotherapy here, don't we? When we take care of ourselves, when we exercise and we eat good nutrition, we're essentially providing ourselves that kind of real positive immunotherapy. Okay, so Dr. Dhaliwal talked about the use of complementary medicine, especially when the limits of traditional medicine have been reached. I'm assuming that at some point they will be used concurrently. Agree?
100%. I mean, so they should be used in combination as an integrative approach, right? I mean, that's the goal. And so what we need to do is, you know, not wait till somebody's end stage and we've tried everything and then, oh, let's try acupuncture now. No, it should be an integrative approach so that we think about a patient holistically, look at their diet, nutrition, you know, their exercise, everything, and look at them as a person. And then think about how can we impact the patient at various levels to help them in the best way, right? So everything should be considered at the outset. And we really need to have kind of a strategy. So it's not just, you know, oh yeah, just take this drop and come back in 5 weeks. Well, you know, it'll be take this drop, try this change in nutrition, try this. And, if that doesn't work, there's acupuncture, or there's this, that, whatever. So I don't think it's just for end stage. I think it should be all incorporated together. And that's what we're striving to create.
Wonderful. So please elaborate more on the possible connection between uveitis and optic nerve damage. Have you done any treatments of optic atrophy with your new techniques? So Dr. Errera.
It's a new technique. Actually, we know that patient with uveitis, inflammatory eye disease, it can affect any part of the eye, the retina, the choroid, the iris, the optic nerve. So I will definitely include patient with optic neuritis, inflammation of the optic nerve, in that trial. I would like to start with patient who had no treatment, with just the uveitis is just starting, active and just starting. So at that point, there won't be any optic atrophy. Because optic atrophy is when there have been an inflammation for a while and as that has not been controlled, or that could not be controlled. So hopefully it will prevent the optic atrophy in the other eye, or it can prevent the optic atrophy to get worse, because any relapse of optic neuritis can generate even more atrophy.
Wonderful.
But the optic nerve inflammation will be taken into account for sure in that study.
So, Dr. Dhaliwal, you had said and mentioned in your presentation that there's been research on holistic approaches to reduce stress and the impact that might have on glaucoma. Is there a connection between stress and worsening eye conditions such as glaucoma? Have we studied the stress response in these conditions?
So I think the hypothesis in that paper was, with stress and cortisol release, that this is going to affect, patients with glaucoma in a negative way. The stress kind of signaling, even in macular degeneration, whether it's stress creating inflammation, right, is creating these negative impact, this negative impact to the retina, to the all of our body processes, right? We know stress and high blood pressure, stress and heart disease. I mean, stress is bad. So let's just all try to take the anti-stress pill and we'll be set. So maybe that's just breathing, right? Maybe that's just something that we need to do for ourselves. Maybe the best pill is no pill, right? Maybe it's like something that we just need to retrain our bodies and minds to approach situations in a way that does not create a stress response, right? So that we're going to be faced with stressful situations throughout our life. We can't control our external environment, but we can control our response to our external environment. So that's where that whole, kind of this mindfulness and this, stress relief comes into play. And that, I see this playing out in every facet of my life, whether I'm speaking to my kids or, patients or whatever. It's how we react that can really determine what impact that's having in our bodies. And so I would highly encourage everybody to just start breathing and mindful breathing. And there's so many easy ways. There's apps on your phone that you can get to, just learn how to be mindful. Some people think, oh, I can't meditate. I can never even clear my mind for 30 seconds. How could I sit quietly? There's apps that really kind of guide you through these things that are really a really nice, helpful introduction. So I think that relieving stress can really help us in so many, many ways. And I would love to hear Dr. Errera's response to that question as well.
I fully agree with you. There is a retina disease called CSR, chorioserous chorioretinopathy, and this disease give a blurry vision to the patient. They get a detachment of the retina with fluid underneath the retina, and that almost always young patient, very stressed, anxious. And we know that they have a high level of steroids, cortisol in their blood. And when we reduce their level of stress, they get better and the vision comes back to normal more often. So that's why in the study, I'm going to study stress hormones, and with a questionnaire about anxiety, sleep deprivation can be related perhaps as well. So we'll see, and we'll end up with a better knowledge of this disease, and we will have a plan, like you said, an holistic approach, a plan for our patient to tell them what to do, what not to do. And so I agree with you.
Thank you. Another question here. So have you or will you be studying causes of increasing pigmentation in the eye and its possible cause by any of the variables that you've been studying? Increased pigmentation.
Perhaps that's retinal pigment change. I'm
Yeah,
not sure.
I'm assuming, yeah.
Probably that. So I'm going to turn it to Mary-Hélène to answer that one.
It's a very good question, and unfortunately I'm not knowledgeable on it. I haven't seen myself an increased pigmentation related to stress or food or diet. I don't know. I don't know, but perhaps there have been publication and study. I'm not aware about it. But in my everyday practice, that's not the case. I see increased pigmentation in patients who had inflammation in the eye. And that's the way the retina heals. If there's been an inflammation, a scar tissue, you have an increased pigmentation because unfortunately the cells, the photoreceptors, the nerve cells inside the retina, they die. And when they die, they release a pigment. And it's the same for the retinal pigment epithelium. It's the layers of underneath the retina that gives the nutrition to the retina. And when this retinal pigment epithelium is missing or lacking, and you have a release of pigment as well.
So I have a question. So I think it's an accurate statement to say that we've seen from what we've experienced and what we've gone through with the pandemic, an increase in stress in society. We certainly have seen it from onset of depression and anxiety in many ways, social isolation. Have you seen anything in your clinics that relate to the increased stress causing any more referrals for these stress-related conditions?
I can answer if you want. I think we need really just to have this type of study to study the level of stress hormone in the blood to be able to tell. So perhaps I will be able to tell you more in 3 years when we'll have finished that study. What I can tell you is during COVID, I saw more uveitis, more inflammation in the eye. The problem is that it might be related to COVID, to perhaps vaccine. We know it gives a little bit of inflammation of the eye, but that's reversible with steroid drops very fast. We have seen patients who couldn't go to the clinic because they had COVID or because they were anxious to go to hospital and perhaps to get infected by COVID. So they waited longer. And so the disease was more difficult to treat. And they have perhaps a loss of vision because we haven't been able to treat them on time. So it's very difficult to tell if it's related to the level of stress or all those factors, confounding factors.
Wonderful. So I'll make this the last question because I don't think I see any more. And I think we've asked every question here. Will there be a specific suite in the new hospital for these holistic treatments?
So Lonnie, we should ask you that.
Well,
or we should direct that to Dr. Sahel because I don't exactly know the answer. I don't know if Maria-Hélène knows, or if you know, so we would love there to be a space, to have space. We definitely need more resources. I think that's, a plea that we'll make. We would love support in this endeavor because, as you can imagine, although, this is accepted by the NIH, to really get funding, you really need these pilot studies, and to do the pilot studies, we don't have funding. So, it's like a catch-22. So,
Right.
so really we definitely need support. And what we would love to do is to have, for our patients, to have the acupuncturist, to have the nutritionist, to have the psychologist, to have, these people there on site, so that
Right.
you don't have to go to yet another building or to another place to get the holistic approach to your eye disease, so that you can just one-stop shopping. That's my dream, and I think Marie Ellen's dream. But to make that a reality, obviously, we would need a support, and definitely have a really great game plan to be able to make this a reality. So,
Well, I the only thing I can tell you that I know in terms of conversations and discussions is around the care for people who also have diabetes, because diabetes, of course, has a significant role in increasing vision loss for diabetic retinopathy. So there is discussion, with planners for the new building also to have, access, nutrition, as well as, diabetic food tables and so forth for people who have to have that aspect of their risk factors managed, and is to also help them save their vision. So I think that there's room for it, for sure, space for it, for more. And I think you're right, Dr. Dhaliwal. I think if we have the support to get programs started, and we can make all of that work, I think that there's no question that we know there's interest, and we definitely want to know more about it, so we can continue to make the case for it to be accepted as a medical practice. So, okay, thank you all so very much. Thank you, presenters. You're wonderful as always, but also I really love the topic. I'm a fan of health, nutrition, exercise, everything else, always, and I do believe in the holistic approaches in combination with traditional approaches and essentially integrated medicine. I certainly have followed that a long time. So thank you all, and we'll look forward to having another Sight and Sound Bites presentation in 2 weeks, which will be one of the otolaryngology side of the street for us. So we'll look forward to having some of you or all of you come back for that, and look forward to more programs in the future. Thank you all.